So let's look at risk factors
Okay.
for diabetes, looking at age, race. Obviously, it's not all one size fits. There's different factors that impact, like age, right? So go through some of these risk factors. And, we know we have a broader audience of the immigrants, demographics watching when it comes to race. Like, what are the risk factors?
So one big risk factor is genetics, family history.
Okay.
So the lady that brought her son that I told you about before, she was diabetic. So if your brother, mother, father, sister is diabetic, or there is a higher chance that you might be diabetic.
Okay.
Okay. I've also had patients who have become diabetic, and I ask the question, do you have any relative in your family that's diabetic? Yeah, my mother's diabetic. So genetics is a big factor. Lifestyle.
Okay, that's a big one.
That's a big one. big one.
Yeah.
So if you're not doing anything, there's some people who like watching TV all the time. No exercise. I'm not gonna. There's a name they call them. I'm not gonna call them that
Okay.
name. But people that like watching, don't do a lot of exercise and sit on their couch, eat a lot of snacks.
Yeah.
Sedentary lifestyle.
Right.
Because that can also lead to obesity, which is another big one. Can lead to it's a risk factor for diabetes. Obesity is a big one as well.
Okay.
A big one for diabetes. You understand me? Poor diet. I love my chocolates. I love my processed foods. That's a big one.
Yeah.
So people that like sweets, chocolates, that's a big risk factor as well. Age is more common after 40 as well.
Okay.
Okay. So why I've picked up diabetes in all ages. You understand me?
Yeah.
Teens, children, older people as well. In fact, a lot of people after 60 get diabetes as well. So I picked it at any age you can get it. You understand me? Hormone disorders as well can predispose some people as well. So these are the major causes. Now, what about racial? I know that kind of thing. Unfortunately, sorry to say this, guys. Being black, high risk factor. Understand me? Hispanics as well.
Yeah.
Hispanics, especially the Mexican Americans. Asians as well, very big. Because I'm from England, as you know.
Yeah.
I was born in England, and a lot of the Asians there had diabetes.
And what's
It's a risk factor. There's, the predisposition,
right.
They've got a high risk factor, you understand me, genetic as well.
Okay.
And if you want to go to some statistics, let's talk about Black Americans. Okay.
It'll be nice to put things into perspective.
12.7% are diagnosed with diabetes. That's a big number. Compared to the white Americans that are 7.5%.
Wow. And this is a variety of the type.
And then Hispanics, which is the Latin American listing, 11.8% have diabetes.
Wow.
But because Hispanics, you've got those from Cuba, Mexico,
right,
from South America, but the Mexican Americans are at the higher risk.
Okay.
And then the gestational diabetes is more common in the Hispanics as well. Okay. And there's a higher risk as well amongst the Asians, like I mentioned before. Yeah. And even the slim ones. Yeah. And South Asians as well are particularly vulnerable to insulin resistance. So it is a big thing.
So some of these risk factors we can't modify, right? Like our age, our, genes, but there's some of them that we can modify, like the lifestyle, right? Lifestyle changes, rather. So I guess it's just important for us to choose a more healthy lifestyle, right? And then possibly, can it slow down how soon we get diagnosed if we work on those lifestyle changes?
So if it's genetic, you're eventually going to get it. But then what it could do is that your symptoms may not be as significant, as severe as when you're not doing anything about it.
Right.
So if you're very overweight, your symptoms are, maybe worse than somebody that was slimmer. Do you understand me?
Right.
In some instances, not all the time, you understand me? And it works a lot because, by the time, if you're obese and you lose weight, I've had people who, as they've lost weight, the requirements have the medication requirements have been modified in a positive direction.
Right.
So losing weight helps you understand me, in terms of controlling your diabetes as well. You understand me? Exercise is important as well.
Because this all help to regulate the blood, your blood sugar. Basically,
exercise is important. 150 minutes per week. So we normally say 30 minutes a day. Now the question is, oh, doctor, I don't have the time to do 30 minutes a day. Why don't you do 10 minutes 3 times a day?
And find creative ways.
Now they say, it's too cold, -50. Hey, hang on. What about your house?
True.
Walk up and down the stairs for 10 minutes. Walk around for 10 minutes. You can have your favorite podcast or your favorite music on while you're walking around for 10 minutes.
That's a great tip.
Every hour you could do 10 minutes. So as long as it accumulates to 30 minutes, it can help. You understand me?
Okay.
But like I said, if you're in an environment where the weather is good, you can go outside and do 30 minutes. I'm not saying you have to go and get a gym membership to do this. Walking is actually fantastic. So you can go out and take a walk for like 30 minutes. You understand me? If you're in a gym, that's fine.
Okay. All right, great.
And if you have a treadmill, just use a treadmill.
So you can basically slow down how soon you can, and even when you have it, all these, which we'll go into.
Yeah, so it may not slow down. It might not slow down when you have it.
Okay.
May or may not, but it can help the control. You understand me? It will help the control.
Regulate your blood sugar better. Yeah. So you can manage it.
Yes.
Okay. So talking about race, how, because of course, there's different factors impacting that, socioeconomic status, access to healthcare, and even our cultural practices, like dietary practices. Yeah. So as healthcare providers, as policymakers, how can we bridge the gap, narrow that gap of disparity amongst the race? Because we see more of the Blacks, Hispanic are being impacted, and there's other factors that's impacting that.
Number one, podcasts like this.
Okay, good.
Yeah. Your podcast, very important.
Yeah,
because knowledge is important. A lot of people don't have the knowledge. They don't even know that this is wrong. You understand me? Like
absolutely,
somebody is having crisps in the morning, crisps in the afternoon, chocolate in the evening, chocolate before they go to bed, sweets in the morning. They don't know that this may lead to them having diabetes. You understand me?
Right.
Somebody may not know that they have to exercise 30 minutes every day, 5 days a week. Somebody may not know that they need to eat more of lean proteins, you understand me, and fiber, whole foods. So they may not know, you know. So that's why these podcasts are very important, where at least you share the knowledge amongst everybody, individuals, and this can help. So knowledge is important. That's the first thing.
So seek for it, go get it,
Listen to Annette's podcast. Listen to Annette's podcast. You see what I'm saying? That's important.
That's right. We're here to bring the best evidence-based information to you. Okay. Thank you for highlighting that.
Yeah.